There it goes. Okay. Hello, good morning, everybody, or afternoon, wherever you might be. My name is Jolene Kagiyama, account manager for Mountain Pacific, and welcome to our weekly It's Worth a Shot. Today we have an amazing guest presenter we'll talk about in just a minute, but we're going to be focusing on activity enrichments in long-term care. Mary, next slide, please. And as always, we have this disclaimer that presentations may contain information and or content by third parties, and it does not constitute an endorsement or recommendation by Mountain Pacific. Next slide, please. And just some updates and reminders from Mountain Pacific. The 2024 Virtual Annual National Healthcare Safety Network, our NHSN training. There's some access videos and slide decks there that they have their annual training coming up. We'll put that link in the chat. You can definitely get enrolled for that upcoming training. Mountain Pacific has also been working hard putting together some new signs of sepsis resources. Know your signs of sepsis flyers. There's the gap analysis. There's a toolkit. They're all now uploaded onto the Mountain Pacific website. And the links are here as well. Take advantage of those free resources. And as always, reach out to your account manager in your respective state if you would like any additional information or some targeted assistance or outreach. Mary, next slide, please. And next week is 4th of July. So our session next Wednesday, we are doing a pause for the holiday. So enjoy that Wednesday, give that one day back to you, but we will resume again on July 10th. So we wish you a safe and happy 4th of July. Next slide, please. We always like to hear what your webinar topics would like to see. So drop them into the chat. There's also an evaluation form that Mary will put in the chat as well. So when you complete the evaluation form, also tell us some additional topics that you would like us to share on in a upcoming It's Worth a Shot. All right, next slide, please. Oh, sorry. There is a polling question. So are you familiar with our SOS resource that goes out every Wednesday? And then rate the usefulness of the SOS resource to you.
You can scroll down in the box to get the full
Thank you.
5 through 1, I believe it is.
Okay. So 5 being very useful, 1 is not useful. So take a few moments, rate that. That's sharing out our resources. And it comes out every week.
Sharing out suggestions.
Thank you. Sharing out suggestions resource. And it comes out every week, and we're highlighting F tags in our nursing homes that most targeted F tags. And so it gives there lots of good ideas and suggestions on overcoming those deficient practices. All right. Let's see. We've got 19 out of 33 on the call today that have completed the poll. How about anybody else? Can we get this up to 20? One more person? Awesome. Thank you, guys. I appreciate that. All right. So we'll go ahead and end that poll, Mary. Thank you. All right. So 90% of those that responded did find the benefit of the SOS resource. So thank you for your feedback. 63% have said they found it very useful. So thank you. I appreciate that. Okay, we'll close that out. Any other polls we have going? All right. Okay, so I want to introduce you to Heidi Caldwell. Heidi is an activity director at a small nursing home community in Honolulu called Haleolekino by Arcadia. Heidi is a recreational therapist with a master's degree in recreational therapy from the Texas State University. She earned her Certified Therapeutic Recreation Specialist certification in 2017 and have accumulated over 8 years of experience in skilled nursing and acute rehab hospitals. She specializes in helping our kupuna or elders discover meaningful reasons to engage in daily activities through personalized leisure interventions as part of their care plans. Outside of work, she cherishes spending time with her 2 dogs, visiting the beach, painting, stand-up paddleboarding, and practicing yoga. Heidi, I'm going to turn the mic over to you. Thank you so much for joining us today.
Thank you, Jolene, and thank you for having me. So yes, my name is Heidi Caldwell, and I am a recreational therapist. I'm here to talk to you about what that means and also talk about the rationale for recreation therapy and its licensure in skilled nursing facilities. So as recently as the late 1900s, oh no, stay on that same slide. As recently as the late 1900s, and yes, I am talking about the 80s, regulating the quality of care in nursing homes has become more prominent to today's standard of care, which requires facilities to have an activities program, also known as FTAG 679, which says, facilities must provide, based on the comprehensive assessment and care plan and the preferences of each resident, an ongoing program to support residents in their choice of activities, both facility-based group and individual activities and independent activities, all designed to meet the interests of and support the physical, mental, and psychosocial well-being of each resident, encouraging both independence and interaction in the community. So today, I'd like to share with you a bit about how recreation therapy is defined, what it takes to become a certified therapeutic recreation specialist, how that compares to activity director certification. And then I'd also like to take a brief moment just to advocate for the licensure of therapeutic recreation specialists. Next slide. So what is recreation therapy? Recreation therapy, or RT, is a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illnesses and/or disabling conditions as a means to psychological and physical health, recovery, and well-being. We also use a holistic method to improve physical, cognitive, social, emotional, and spiritual functioning to provide individuals with the highest quality of life. So in terms of therapy, I'd like to say that physical therapy gives you back your strength, occupational therapy gives you back your independence, speech therapy gives you back your voice, and recreation therapy gives you back your passion. Next slide. So what does it take to become a recreation therapist? Well, our credentialing program was established by the National Council for Therapeutic Recreation Certification, or the NCTRC. We are required to complete a minimum of a 4-year bachelor's degree in recreation therapy or related fields from an accredited university. We're also required to, within that 4-year degree, we must have 18 semester hours in recreation therapy content, or approximately 5 courses. We also need to do additional coursework in anatomy and physiology, abnormal psychology, and human growth and development. We're also required to complete a 560-hour internship that includes covering the 69 items in the job analysis provided by the NCTRC. Of course, we must successfully complete our certification exam. And then to maintain our credentials, we pay annual dues, and we're required to earn 50 hours of CEUs every 5 years. Next slide. So how does that compare with activity director certifications? So activity directors are credentialed by the National Council for Therapeutic Recreation Certification. I'm sorry. They're credentialed by the National Certification Council for Activity Professionals, or the NCCAP. And they're required to do a minimum of a high school diploma or GED, plus 12,000 hours working in an activities department, or 40 hours of continuing education on aging, leisure, leadership, public speaking, interpersonal communication, relationships, regulations and programming, and then of course also passing their NCCAP exam. So you can see that while both professions are valid and both provide value to and great benefits to the populations they serve, the more in-depth training on disability, psychology, programming, adaptation, and health provides CTRSs with a greater knowledge base and experience for working with residents who have complex medical issues, as they do in skilled nursing facilities. CTRSs go beyond the provision that activity directors use, providing, meaningful and engaging activities. We're also working to restore, remediate, and rehabilitate function and independence for our residents. And I feel this is an aspect to therapy, to the therapy team that's been often overlooked, because as of right now, there are only 5 states in the union with licensure for recreation therapy. And without licensure, recreation therapy is not a reimbursable service. So I'd like to just take a quick minute to talk about and advocate for licensure of recreation therapies. So next slide. The rationale for recreation therapy licensure, of course, we have consumer and professional benefits. States actually require a license to be recognized as an allied health professional. The profession must be licensed by the state office of the professions and listed in the state health plan. And to become licensed, recreation therapy must be recognized by law. So why is that important? Let's take a look at the next slide. Well, first of all, preventing harm to the public. We have people using the term recreation therapy or calling themselves recreation therapists when they, in fact, do not have certification. It provides professional integrity. We'd like to have a seat at the table with the PTs, the OTs, and the SLPs. It also assures at least a minimal competence, but I would think that with a license, you would assume a person has the highest level of competence in that field. And then it also allows us to maintain a standard of practice. So we would have the ability to establish a board who could discipline or revoke a license or certification. And it also gives us title protection, meaning you would have to have your CTRS in order to call yourself a recreation therapist, or that you are providing a recreation therapy program. So, but what is the main reason? Next slide. Billing for our services, of course. Yes, that is important, but more importantly, it is the highest form of protection for the consumer of recreation therapy services. So how does that all tie in? And what are the justifications for recreation therapy, whether you're licensed or not, for having that in your skilled nursing facilities? Let's take a look at the next slide. So FTAG 679 and 680, they emphasize the need for resident-centered programming. These are programs that provide opportunities for a meaningful life. The regulations address assessing and engaging residents according to their individual interests and lifestyle. And these programs must be directed by a qualified professional. Survey and agency outcomes. Well, the regulations offer guidance on interventions and approaches to address various behaviors and mood issues, many specific to dementia. An emphasis is placed on reflecting daily life instead of a formal activities program, and to demonstrate a typical life routine as opposed to that of an institution. Each of the regulations address components and competencies that CTRSs employ, including our APIDE process, which is something that we use in our practice. It stands for assessment, planning, implementation, evaluation, and documentation. And all of this is to meet the residents' holistic needs. Let's see. Oh, and also RTs have had a positive effect, anywhere from $30,000 to $70,000 return on investment in nursing homes, which are related to a resident's quality of life, fall prevention, and non-pharmacological behavior interventions. Culture change. So person-centered care, which is moving away from the medical model, also shares a similar scope of practice with recreation therapy. Person-centered care embraces non-pharmacological interventions, resident autonomy, and opportunities for purposeful leisure, and has been recognized by the Center for Medicare and Medicaid Services as a regulatory requirement to increase the quality of life of its residents. And studies have even shown that nursing homes that embrace culture change were associated with better resident care and less deficiencies. And speaking of non-pharmacological behavior interventions, many nursing home residents experience mood behaviors and issues related to life changes, aging, or specific diagnoses such as dementia or Alzheimer's disease. In fact, the CDC reported that 46.4% of nursing home residents have a diagnosis of depression, and 46.8% have dementia or Alzheimer's disease. It's well documented that activity, a positive therapeutic modality, has a potential to enhance the quality of life and reduce behavioral symptoms in persons with dementia, thereby eluding pharmacological treatment. Adaptations. Adaptations are an important factor to increase the engagement based on a resident's abilities and limitations. And CTRSs are skilled at selecting resident activities designed to decrease behavioral symptoms by modifying the physical environment, such as the lighting or the sound, the group size. And all of that has been shown to yield effective outcomes. Supporting residents in reducing their frustrations, increasing their successful activity completion, and engaging in meaningful activities are all competencies that CTRSs employ with residents in skilled nursing. Engagement, meaningful engagement. As we've seen from COVID, engagement is considered a human need, and recreation therapy plays an important role in facilitating that. Successful programs use a resident's past lives or their occupations to design programs that are meaningful to each individual, further promoting the person-centered care model. In fact, the federal regulations actually require activities to reflect a person's interests and lifestyle, and that they are enjoyable to the person and help the person feel useful, help them provide a sense of belonging. And FTAG 679 states that the intent of this regulation is to create opportunities for each resident to have a meaningful life by supporting his or her domains of wellness, including security, autonomy, growth, connectedness, identity, joy, and meaning. CTRSs are skilled to promote connectedness and communication, continuing of their life roles, promoting self-esteem, enhancing personal meaning and accomplishments, and maintaining functional abilities while reducing social isolation and depression. For restoration, maintenance of function, and fall preventions, CTRSs who are working in nursing homes can play a vital role in helping to restore, maintain, and improve the functional abilities of the residents in long-term care. CTRSs provide active treatment to improve physical, cognitive, social, emotional, and leisure domains of function. And CTRSs can help to restore and maintain a variety of abilities through individual treatment and small group interventions. Involvement in restorative nursing programs by the CTRS can actually affect your facility's PDPM rate in a positive way when it's captured under the Section O of the MDS in restorative care. CTRSs can also provide interventions to reduce the risk of falls, thus injury to your patients. And co-treatments. Recreation therapists would love to be able to work with other allied therapy disciplines to provide the treatment and interventions to improve the person's functional abilities. We can co-treat either in individual or group settings. We can be doing it with speech language pathologists, as well as physical and occupational therapists. And CTRS is working with residents with neuropsychiatric conditions, depression, behavioral issues, strokes, Parkinson's, arthritis, and dementia. All of this can have positive outcomes for the individual. So CTRSs are often reinforcing the therapy treatment with our activities, walking, working on communication skills, all that to improve a resident's functional outcomes. And we could also be used as a discharge site for when PT, OT, and SLP treatments are completed. In fact, here in my facility, I have created a weekly recreation therapy group wherein I work with the PT or the OTs, and we co-treat together, and we're actually doing adapted yoga. And it's just been really fun, and it's quite successful actually in getting and introducing new interventions to our residents who, once they've completed their skilled therapy and they're discharged home, they're taking home with them some new fun ways to continue working on those therapy goals. So yeah, that about wraps up everything. I guess what I would have to say is that if you are in a position to hire the person that does your activities, or is your wellness director, your life enrichment coach, whatever, that I implore you to look for the qualified recreation therapists to put in those spots, the CTRS, so that once we do gain licensure in every state, it'll be that much easier for you to start reimbursing for those services. Thank you so much. Of course, you can go to the NCTRC website to find out more about recreation therapy. And I open the floor to questions or discussion.
Heidi, thank you so much for a very insightful and educational session to the group today. There was a question in the chat at which 5 states recognize the licensure already, and those states are New Hampshire, New Jersey, North Carolina, Oklahoma, and Utah.
Yeah.
So lots of
New York
work.
is coming up. No,
And
New York is also working on their licensure, and fairly soon, hopefully Hawaii.
Yes, that sounds great. So another question, how can nursing homes incorporate a CTRS into their environment in our states?
So hiring them to be your activity directors.
Okay, very good. And then I know that you mentioned 560 hours of internship.
Yeah.
And I know at Haleolekino, you originally started there as an intern, and the facility was able to find you through a website. Is there something like that still existence that these nursing homes could reach out to these students to solicit them to come to their community for internship?
Yes, well, good question. First of all, interns have to be supervised by a certified therapeutic recreation specialist in order for them to complete that internship. So you would first have to have a CTRS in place before you could have interns. But there isn't any specific website. For me, now that I am a CTRS in this facility, I recruit interns by, through a variety of different ways. I use Facebook groups to advertise to other recreation therapists. who might be in a university setting, teaching students who could pass on the information that I'm offering an internship. You know, I mean, everything from just Google searching recreation therapy internships. You might find some postings here and there. I believe when I found the listing for an internship here at Haleolekino, it was through a job website, and I just, you know, filtered it down looking for internships, specifically recreation therapy ones. So it's really just taking a lot of word of mouth and advertising, or getting the word out to you, universities that have recreation therapy programs, to, you know, inform those professors of your internship opportunities.
Heidi, one more question. Do you know what colleges actually offer this degree?
Well, there's several, and in fact, none of them are in Hawaii. So I often have to recruit to mainland universities. Texas State is a good one. I can attest to that. Temple has a good recreation therapy program. The interns that I've had came from Fresno State and Utah. But yeah, they're all over the country. You just have to find out if they're, you know, just look up their course curriculum to find out if they have a recreation therapy in their human. I think it's, you know, they're kind of in the same department as people who are in, you know, going to be PE teachers, you know, things like that.
Okay. Very good. Thank you so much, Heidi. Any other questions in the chat? Just a comment here, Heidi, you're doing very important work. Thank you for all you do and the knowledge that you shared today.
Thank you.
And then another comment is our life enrichment and activities department at our community does a phenomenal service to our residents. All right. Thank you so much.
I think it, you know, it really, it creates a culture, you know, of a facility, when you have an active and involved activities department.
Absolutely. All right. So those of you who have working in skilled nursing, you find that your activities team, not just your nursing team, it's a whole interdisciplinary process. And they play a very crucial role to the health and well-being of the people that you serve. Heidi, thank you again. Thank you for your heartwarming presentation and the slides that you shared on some of the events that you are doing in your community. And then lastly, before we hang up, please complete the evaluation. The link is in the chat. We always love to hear your feedback and your comments and any other additional webinar topics you would like to see coming forward. And then next week, Wednesday, we are on a pause, and then we'll see you back here July 10th. Have a good week, everybody. Aloha.
Aloha.